This is Dr. Gerhauser, and today I want to talk to you about a very important health concern, and that's elevated blood pressure. So let me ask you, do you know how doctors determine what a normal blood pressure is? Well, I'll tell you, the recommendations are made by a panel of experts, and they have a meeting and decide. Now, hopefully it's based on research, and this research hopefully can help determine at what level there's significant health risks and the evidence that treating it actually does something. Now, currently, a systolic blood pressure reading above 140 millimeters of mercury or a diastolic reading above 90 is considered hypertension or high blood pressure. Now, recently, some experts have suggested reducing the normal systolic blood pressure to 120 millimeters of mercury and the diastolic down to 80. Now, of course, by doing this, they get millions of more people on blood pressure medications. Now, there is a basis for this recommendation because some of the studies show that there's less cardiovascular diseases and kidney failure when you have a blood pressure below 120 systolic. Now, it's interesting to note that many of the members of these expert panels are speakers, researchers, or consultants to the drug companies. And this is the drug companies that make these blood pressure drugs. Now, it seems as though there could be a conflict of interest here. Now, if you do a study that finds that having a systolic blood pressure above 120 millimeters of mercury increases the risk for certain diseases and mortality, it doesn't necessarily mean that getting on a drug is the answer. Now, this is even if the drug is FDA approved to lower blood pressure. Now, a case in point is the recent Cochrane database of systematic reviews for the pharmacotherapy of high blood pressure, and this was published in 2012. Now, in this review, the Cochrane researchers reviewed the clinical trials of blood pressure treatment. Now, this resulted in data on about 9,000 patients, and they were treated for high blood pressure over a span of 4 to 5 years. Now, when people had a blood pressure that was considered elevated, which is 140 to 159 systolic or 90 to 100 diastolic, and were treated with drugs, and this was compared to no treatment, there were no statistically significant fewer heart attacks or strokes, and there was no improvement in mortality. So when we visit the doctor, and he or she always checks our blood pressure and then insists on treating it, and many times gives you a sample of the drug that the drug rep left in their closet, he brought it over when he brought the doctor and the clinic staff lunch, and he gives you a sample. Now, we have strong evidence here that that may not help. And there's no verification that it's worth the risk of the side effects, the costs, and especially the high costs of a new drug that's still under patent protection. Now, I know the drug companies have supplied our clinic with all kinds of samples of the new blood pressure medications, and they try to convince us to get our patients on these new drugs that are expensive. And that's even though there's no proof that they're effective. But yes, they're FDA approved. So what are they FDA approved to do? Well, in the short term, they lower your blood pressure. And as an important side note, they're also proven to cause side effects. But the ultimate reason that we take them is to prevent death and disease. And these aspects are unproven. Now, this is Dr. G. I appreciate you watching our videos. Please subscribe and share this information with friends and family.